So many people develop leg pain every day and are curious to know what they can do to reduce the amount of pain that they undergo. Some feel that it's a burden and tiredness in the legs. Some are really affected by it. And at night also the pain just doesn't stop. Many of these causes of leg pain may be symptoms of artery or vein problem, and exercises play a very important role in these people. So today I will tell you about simple exercises that you can do at home without any equipment to reduce the leg pain that you have. But remember, if there is any major cause of leg pain, you should always consult your doctor before trying out these exercises. Before I tell you about the exercises, you must know or understand what causes leg pain. Pain in the legs can be due to many reasons, and few of the problems may be related either to the bones, sometimes to the muscles, sometimes because of nerve problems, and sometimes because of your artery or vein issues. And all the causes can lead to leg pain. It is important to differentiate and identify what exactly is causing leg pain. So before you get started to doing exercises, a proper warm up is very essential. What the warm up helps to do is that it makes your joints and muscles prepared for an exercise. So don't skip this part and move or jump straight away to exercises. We've shown these warm ups in many of our earlier videos, and these can be warm ups which you can do for your hands, for your legs. We are showing a few of the clips here. So you know that a proper warm up is essential before you start doing the actual exercises. Coming to the main exercise for improving your leg pain, activating your calf muscle is very important. Your calf muscles are the pumps which help push the blood from your feet towards your heart. So they actually act like a second heart or a peripheral heart. Now I'll show you how calf pump exercises can be done. You may stand behind a chair and hold it very lightly just for balancing out. Keep your feet hip width apart and then hold on to the chair with a light grip, not too firm, only lightly, and make sure that your posture is proper. Now, while doing this, raise your heel as high as you can, hold on to a breath of 3, and then lower them slowly without letting them rest fully. And then again raise the heel up. And you can repeat this for 20 to 25 times at a stretch. What this action does is called as calf pumping. This activates your calf pump and helps to tighten those muscles. Within those muscles are the veins which will get the blood going up. If you find that this is easy, you may even do a calf stretch without holding on to the chair. You can just do it like this without the support of a chair. And if you feel this is easy, you may want to try out certain variations that I'm showing now. One of the variations for calf pump is called as internal rotation and external rotation. So this is the way we do it. When I am rotating my feet externally and then raising my calf, then I'm working on the medial part or the most inner part of the calf muscle. So you can do this exercise with your feet pointing outwards, and that will help to really build strength in your medial part of the muscle. The similar opposite is where the feet are turned inwards, and then you do the calf pumping, and that will help work on the outer part of the calf muscle, which are the lateral part. If you still feel that that is very easy to do, then do see this video where we've shown how it can be done even on steps. So when you're doing a calf stretch or a calf pump on a stairs, you have the advantage of keeping your feet at a higher level and allowing the feet or the heel to go below that level and then get the push. So that would be much more effective than a simple calf pump. But more than the importance of variations, I think it is consistency which matters the most. So make sure you're able to do these calf pump exercises, any variation that you like. Try to aim for 25 to 50. And if you are benefiting from it, then it can increase to almost 100 times in a day. The next exercise is a seated leg extension. So like we worked out for the calf muscles, Working out for your quadriceps or thigh muscle is equally important. And this is the way that we do it. So while you're sitting in a chair, because it's a seated exercise, sit on a chair, one leg on the ground, the other leg is raised and extended till it becomes a straight angle at your knee. And at this level, hold for a few seconds. You can even do some ankle pumping exercise along with this to improve the stretch in your calf muscles and the quadriceps muscles. Then take it down slowly and repeat this on the opposite leg. So while you are doing it, make sure that your thigh muscle, the quadriceps, is really engaged and you're not using all the other body parts or swaying onto one side while you're doing this exercise. Now, this exercise will help you work on the hamstring or the back of thigh muscle. You can stand with support of a chair and try to fold your leg so that it turns backwards and is about to touch your gluteal muscles or the hip. So when you're doing this movement, you are utilizing the hamstring muscles, which also need to be exercised when you are working out. The tight hamstring is a very common cause of leg pain in many people, especially people who are standing for longer time or even sitting for longer time. Now, this exercise which I am showing you is called as a wall sit. You literally sit against the wall, and it is a wonderful isometric exercise, very helpful for your thigh and leg muscles. And the surprising part, it is one of the most effective exercises to reduce your blood pressure. And this is how we do it. So you can be standing while your back is supported on the wall, lower your body so that the leg is lowered like you are in a sitting position. Hold on to this angle where the thigh and the knee is at a 45 to 60-degree angle. Hold on for a period of count of 20, and then you can slowly come back again. Now, if you feel that this is too easy for you, you can still slide down further till your knee is at a 90-degree angle. This becomes more difficult to hold, and if you're able to hold it for 20 to 30 seconds, that will be very useful. You can literally feel that your quadriceps and hamstring as well as gluteal muscles are really tight and holding on tightly. And then you can again come back up. And when you're done with these exercises, don't forget to stretch out the muscles that you have used so well. The first stretch I'll show you is the calf and hamstring stretch. And this is how we do it. Stand with support of the wall, keep one leg with the feet on the wall, and then go and take your body in front. By doing this rocking movement, what you will notice is that the entire calf and hamstring will get a good stretch. You can hold on to the count of three and then release. Do the same thing on the opposite leg as well. I'll hold on to a count of three and then release. Do the rocking movement again and release. And lastly, we will stretch the quadriceps muscle, which is the front of the thigh muscle. So hold on to a chair or support, raise your leg and feet, and you can make them touch your hip. When you are touching the hip, you're giving a good stretch to your quadriceps muscle. You can repeat this movement or hold on to a count of 10. And don't forget to repeat it on the other side as well. So I hope these exercises were useful to you. And now we should know who should do these exercises and who should avoid them. Well, most healthy individuals can easily do these exercises as a routine. But you should avoid doing these exercises if you have the following conditions. If you have severe varicose veins with open wounds or ulcers, then avoid these exercises. If you have signs of acute deep vein thrombosis, if there is sudden swelling in your leg with pain and redness, then you should avoid doing these exercises. Thirdly, if you have severe knee or hip arthritis, then I would strongly advise you to consult a physiotherapist and do exercises under their guidance. And lastly, if there is uncontrolled blood pressure or heart conditions, then you should consult your physician doctor before you start doing these exercises. And also ensure that if you're doing these exercises and you feel that there is an increase in the pain or the pattern of pain increases or changes, then do consult your doctor before going further. And if you're benefiting from these exercises, make sure you build on consistency, because it's not about a one odd time or a one day exercise. There's no simple, fast hack to control your leg pain. You need to be consistent in doing these exercises. So remember that consistency over intensity is the golden rule for getting relief from your leg pain. And lastly, remember that exercise is not the only thing that you need. You also need to have certain lifestyle restrictions and change in your habits if you want an overall improvement in your leg pain. Staying hydrated, eating healthy food, and making sure that you get enough of rest, they are all essential elements to help you overcome the leg pain that you've been struggling with. And yes, for some people who have swelling, wearing the light stockings or compression stockings will also be very beneficial. And if you want to understand how these stockings help when you're exercising and how they help to relieve your leg pain, then do watch this informative video on stockings.